All right, homeroom. We're here with Katie Schauble. Am I saying that right? Schauble? Yeah. All right. She graduated 5 years ago. And Katie, what I remember about you is you were in EMS. You worked with the ambulance when you were a student, right?
Yeah, I did. I started when I was a junior, so when I was 16.
And what was that like? Were you on call at night, school nights, going out like with accidents and this, that, and the other?
Yeah, so I would say junior year, I didn't do it as much on school nights, but then senior year, I kind of was a little bit looser with getting schoolwork done. I mean, I always got it done on time, but it was more so the early hours in the morning that I was completing some projects because I prioritized going to the ambulance. But I feel like it was really good for starting off my nursing career because it gave me a good sense of like the type of patients that I would be seeing, like the different types of medical issues and traumatic injuries and stuff like that. So I feel like it was, a beneficial way to prioritize my time, especially senior year, to make sure that I wanted to go into the medical field. But yeah, I'd say definitely senior year, I definitely put a lot more time into it on school nights and everything. So
Yeah, I can't imagine being in high school and coming to an accident scene or someone has a heart attack and you have to be on in that way. But that's impressive. And what's it like now? You went to Temple for nursing.
I did.
How was your transition to college? Do you feel like you were prepared?
So I feel like academically, I was definitely prepared. I took all the AP classes that I could in high school. So it worked out that I got out of a semester, but you couldn't finish nursing in less than 4 years. So I just took a pretty easy course load, which made time for other things. So I was definitely prepared academically. And then Temple, as you guys know, is in North Philadelphia. So it's in a pretty rough area of the city in some sense. And it's obviously a lot different than where we all are in King of Prussia. So I purposely chose Temple because I wanted to get a feel for the city life, but I also knew that it would give me like a well-rounded nursing education because the problems that the patients have there in North Philadelphia are not necessarily problems that you'll see frequently out here, just with like lack of resources and everything. So I would say that I wasn't as prepared for that sense since I grew up in King of Prussia and I, lived there my entire life prior to going to college. So North Philly was definitely a lot different than there, but I would say that it really prepared me to be a more well-rounded nurse.
Yeah, and I'd imagine it's different now. You're at Lankenau right now, right? It's your
Correct.
first year full-time working?
Yep.
Yeah, how's that been?
It's been really good. So I was hired for, they do a unique program where they do what they call a two-step program into the ICU. So obviously the ICU is the most critical floor in the hospital. The patients are the sickest that they can be. There's no other place that they'll be any sicker within the hospital. So a lot of hospitals are hesitant to hire you right into the ICU because, you're a new grad, you need to have the knowledge and the foundation and the skills to be able to care for these patients. So the way that Mainline Health does it is they start you on a different floor for 6 to 9 months, and then they transfer you to the ICU so that you're able to pick up skills on your other floor. So I was on the surgical floor, which was pretty interesting. I knew that surgery and that particular floor wasn't my passion, but it was really good for picking up skills and learning time management and everything like that before moving to the ICU. But unfortunately with COVID, we did turn into a COVID floor since surgery was canceled for the most part throughout COVID. So I would say that that's really challenging. I never expected to work in a pandemic, let alone in my first year of nursing. So I'd say that it taught me a lot, but it was also beyond what I ever expected for my first year of nursing.
Right. And I think I know the answer, but you guys are at work. Are you in like a hazmat suit or how, like, what's the protocols that have changed in the last 6 months?
So it was kind of scary when it first started because we got new emails every weekend, sometimes in the middle of the shift about what we should be wearing. So it was kind of nerve-wracking because you would get this email and it's like, oh, you should have been wearing this, but you were wearing a lower level. So you just felt like you were totally exposed and everything. But now they seem to agree on what we should wear, which is like a gown. They've had some variations in the gowns that we wear just based off availability. So we wear that. We wear an N95. So that was different at the start too, because at the start we were told to wear surgical masks into the patient's rooms, which are the regular masks that you guys see people wearing around. So we were told to wear those, but now we wear N95 masks, and then we wear hair coverings, which we didn't wear at the start, but now we've all started wearing. And then we wear eye protection, so just like safety goggles. So that's kind of the standard what we wear. And then around the hospital, it's a required rule that for all patient interactions, we still have to wear the eye protection and the surgical masks to prevent any risk of infection, because there have been quite a few incidences where the patients come in for something completely unrelated to COVID, and then they end up testing positive for COVID. So it's just a way to prevent exposure to us, you know, when we aren't aware that the patient's positive.
Yeah, I feel like things have changed a bit. Like I remember how scary it was at the beginning. I remember I would go to Wegmans to pick up an order, and I was spraying everything was getting sprayed. Like we had our table in the kitchen. We were spraying everything down and then putting in the, you know, and I don't really do that now. I think I hope I don't have to.
Yeah.
Like I've relaxed a little bit, you know, I'm still wearing a mask with people around, but at the beginning we had no idea what this was going to be.
Right. Yeah. And I was exactly the same way. I mean, it was especially nerve-wracking because I moved out in the middle of the pandemic, but at the start of the pandemic, I still lived with my parents, which obviously, you know, being older than I am, obviously, they're at a greater risk. So I was really nervous about working with COVID patients and then bringing it into the house. So I definitely can relate to the fear of the unknown, of not knowing the risk of, you know, possibly bringing it in the house. So I can definitely relate with that.
Yeah. So how about in closing, do you have any message? By the way, these are all seniors here. This is the class of 2021, and they got robbed a little of their spring of junior year, and they're missing out at least on the fall of their senior year. Any advice, any closing message you have for them?
I would say the one piece of advice that I usually try to give people is to just be present in the moment and look for the good in every day. I mean, I know lately with COVID and the pandemic and everything, it's like sometimes, like I know early on in the pandemic, I would wake up in the morning and there were some days where I'm like, all right, there's 16 hours until I can go back to bed, and that will be another day over and another day closer to being done with, you know, the pandemic or whatever. But then I realized that I was kind of like wishing away time that I couldn't get back. So I started to really be mindful of being present and looking for the good in each day, because even if a day absolutely sucks and you rate it like a 0 out of 10, there is good in every day. You can always find something good. And if you can't find something good, as cheesy as it sounds, you can make the good in a day. So I would just urge you to remember that. I mean, I know that college can be a bit of a hard time for some people. I mean, other people absolutely love it. But even if you love it, there will be hard days. I mean, it's just a matter of fact. That's anything in life. So I would urge you to just embrace it for what it is, accept it for what it is, but to truly try to be present and look for the good.
Wow, great message. Thanks so much for joining this morning.
Yeah, absolutely.
All right.